Hi everybody, this is Dr. Matt from Energize Physical Therapy. So today we will be talking about, this episode is actually made especially for ladies who are pregnant. So in this episode we will talk a little bit about whether it's okay to exercise when you're pregnant and to address the issues that come about when you're pregnant relating to pain and what physical therapy does. So first of all, a lot of people have a misconception, well back then, even some now, that if you're pregnant that you can't do any exercises. Like you can't do running, jumping, or swimming, or any activity like that. So what I'm going to tell you is that it's okay. Because a lot of times, well, during certain times of pregnancy, certain trimesters later on, you might be a little bit more careful about if you're going to do jumps, lunges, or things like that, but it's actually okay to exercise, and exercise is actually good for your body. Because what happens when you're pregnant, a lot of times your ligaments in your body, the ones that help you stabilize your joints, they get really loose. So you get something called ligament laxity. So what happens is that, especially when you're walking, pretend you're wearing high heels and you're pregnant, really pregnant, like this pregnant, and you're wearing high heels and your ligaments are loose on your ankles. Easily what can happen, you can sprain your ankle because of the ligament laxity. And what can also happen through time, you can get increased back pain, which is a lot of times what we see people for in physical therapy. So imagine this weight you're carrying right here, right? It pushes you forward and you already have an arch in your back. You get more of an arch, an increased arch, which puts more of a load on your spine. So, and the ligaments are just hanging there and your muscles aren't as strong to keep them, in place and keep your muscles from tightening up. So you get a lot of pain from that, from muscle tightness, from muscles pulling because the ligaments are so lax and they're hanging back here and overstretching. So what exercise are good, you would say? Definitely yoga, more for breathing and relaxation of the muscles, to improve the muscles' flexibility, not necessarily laxity to make it more loose, but to make the muscles more loose. And also Pilates, or core exercises, because a lot of times people after pregnancy, especially when they get C-sections, they get a lot of weakness in the abdomen. So those exercises and Kegels are really, really helpful in your case. So if you have any more questions, feel free to contact me at 855-856-7885. Thank you. Bye-bye.